Good morning, everyone. Welcome to South Dakota HealthLink's second webinar series. Today, we will be discussing our event notification service and how it may be a benefit to your organization. Please note today's webinar is being recorded and will be made available for future reference for those who may have missed this webinar. Next slide. Today's agenda will include a short overview of South Dakota HealthLink's interoperability services, an overview of conditions of participation requirement, and an overview of our event notification service. Next slide. My name is Mandy Steginga. I am the Information Technology Specialist with South Dakota HealthLink. With me today is Kelly Lloyd, who is one of our clinical engagement consultants, and she will be presenting this webinar today. The rest of our team is listed out below. Next slide. South Dakota HealthLink currently has over 68 hospitals and over 400 primary clinics contributing data with member organizations in 6 states, including South Dakota, North Dakota, Minnesota, Iowa, Nebraska, and Wyoming. We are eHealth Exchange certified, which enables us to connect to other health information exchanges and connect with federal partners, including the Veterans Administration and Department of Defense, which is now live. South Dakota HealthLink has well over 1.7 million unique individuals in our Community Master Patient Index, which is how we match patients across our community. As you can see, we have quite the variety of recipients utilizing our services. Just a reminder, we do encourage you to submit any questions you may have in the chat box. We will capture those and follow up either directly or create a frequently asked questions document. Before I hand it over to Kelly, I would like to let our attendees know about current funding opportunities to cover the cost of interface fees until September 30th, 2021, and funding opportunities to cover the cost of membership fees until September 30th, 2022.
We are also going to talk about the upcoming e-notification conditions of participation, and then as well tell you how you can use South Dakota HealthLink e-notifications to comply with that new COP. And we're also going to share some additional use cases for event notifications that may be applicable to your organization outside of COP, and how our users are currently using this service. We do understand that it is a very busy time for everyone. So we have designed these webinar series to be under 30 minutes, but really give you a nice overview of the actual service that we're going to be highlighting, and then as well how that service can apply to specific use cases within your organization. Before we actually jump into the webinar and talk about our event notification service, we did want to share with you just a high-level overview of the interoperability services that are currently available through South Dakota HealthLink. So if you are a member to South Dakota HealthLink, you can take advantage of any of these services through your membership. The first one is our Point of Care Exchange. The Point of Care Exchange is an application that allows providers to access clinical information on their patients within one single platform across the entire care community. We do also offer a closed loop referral service, and this allows providers to send, receive, and track patient referrals across different healthcare settings, all within a closed loop process. We also offer an electronic orders and results distribution service, and this allows providers to receive orders electronically and then route those results directly back into that provider of records EHR. And then a new service that is available in 2021 is around our population health analytics service. And then as well, through that service, you will be able to subscribe to several different types of analytic reports to better understand the overall health of your population. But what we did want to really talk about and focus on today was our e-notification service. So as everyone may be aware on this call, as a condition of participation in the Medicare and Medicaid interoperability under the Interoperability Patient Access Rule, hospitals, psychiatric hospitals, as well as critical access hospitals or CAHs are now required to send notifications to providers that have an established relationship with a patient that is presenting to your hospital for treatment. This new rule is starting in May of 2021, and the rule was really designed to support with information sharing, to enable better care coordination, and then as well improve patient outcomes. So let's take just a closer look at some of the basic requirements for COP. The rule does outline that hospitals must make a reasonable effort of sending notifications for the following event types: inpatient admissions or discharge notifications, ED admissions or discharge notifications. We do have transfer notifications as well. That is a service that is offered through HealthLink. However, that is not really part of the COP requirement at this time, inpatient transfer notifications. The recipients of those notifications are the patient's established primary care provider, the patient's post-acute provider, and then as well, any other established primary care groups that are part of that patient's primary care team. Notifications must include at a minimum the name of the patient, the name of the treating provider, and then as well the name of the sending institution where that care event is taking place. So through South Dakota HealthLink's event notification service, we do offer several different methods that can be used to send notifications out to providers and organizations to meet COP. The first one is a patient registry. So through a patient registry, this will allow providers to receive notifications based on a list of patients or a panel of patients that is in their subscription. So if a provider does decide that they would like to receive notifications based on that subscription or that patient registry, once that patient is matched and the ADT event is received within South Dakota HealthLink, that notification would then be sent out to that subscribing provider. We do also offer the method of sending a notification based on a provider role. This would then send that notification when the subscribing provider who is receiving those notifications, provider code matches the physician of record within that ADT message that is being sent over to HealthLink. And then lastly, we do also offer a discharge to location notification. And typically you're going to see post-acute providers use this method, and it will allow a subscriber to receive that notification when that discharge location matches the criteria within that specific subscription. We also have some technical standards that CMS has applies to this new condition of participation. And currently right now, South Dakota HealthLink Event Notification Service does meet all of those technical standards and is conformant with the content exchange standard outlined within the rule. So we really wanted to now just take a deeper look into what is Notify and how does the actual service work. So Clinical Event Notification Service through South Dakota HealthLink is a subscription-based event notification service. There are several types of notifications that providers can subscribe to or hospitals could actually send out. Those notifications are inpatient admissions, inpatient discharge, inpatient transfer notifications, emergency room admissions, emergency room discharge notifications, And then we do offer a few other notification types that providers can actually subscribe to as well. So if a provider is interested in receiving death notifications for their patients, they do have the ability to subscribe to those types of notifications. And then as well, any types of patient encounter updates or ambulatory encounter updates, providers can also subscribe to those types of notifications through South Dakota Health Link. So how does Notify work? If you are a hospital and you are currently connected to South Dakota Health Link and you are sending over to us those ADT notifications, that is admission, discharge, or transfer notifications, that is what is going to actually populate within our Notify engine and actually match on the back end to those specific subscriptions that a provider does subscribe to. And through those ADTs and that subscription, based on what that provider wants to receive that notification and how they want to receive that notification, that provider would then receive that notification through South Dakota Health Link. One thing that I did want to mention, that if you are a hospital that is currently connected to South Dakota Health Link and you are sending those ADT notifications already, the infrastructure is already in place for you to start sending those notifications out to providers. It would just simply be signing up to get training on the notification tool, and we would show you how to actually create those subscriptions for your providers to start sending those notifications out for your patients. So that is one big benefit. We know that the CMS rule is coming up quickly. So if you are already connected to HealthLink and you are sending those ADT notifications into HealthLink, that technical infrastructure is already done so that you would be able to just actually learn how to use the system, set up your subscriptions, and start sending those notifications out to providers. There are several different delivery channels that we do offer to send out those notifications. We can send out notifications through our Notify Worklist. This Worklist is through our online portal where providers can actually receive their notifications within a Worklist, log into our portal to actually view all of those notifications. This is a secure channel, so there will be additional data types and data elements in that notification for those providers. We do also offer an email notification. This is through a non-secure email, and so there will be limited information as to what's provided within that channel, but that is something that providers can subscribe to as well. We do also send notifications through direct secure email. So if you are currently using direct secure email with your EHR vendor and you would like to set up those subscriptions where providers can receive those notifications through those email addresses, that is also something that our Notify application does support. And then additionally, if providers do want to receive notifications through a text message, we do have the ability through South Dakota Health Link's event notification service to send out notifications to a text message. So let's just take a quicker look and a deeper dive into what those actual notifications look like within those different channels. So this provides you with just a quick glance at what a notification worklist looks like. So if a provider is subscribing to receive their notifications through the worklist, there will be several different types of information that will be provided within that worklist. First being the patient's name. It will also have the sending or source facility, so where that care event is taking place. It is also going to provide the type of event that's taking place. So if this one specifically refers to an emergency admission, it is also going to provide you with information on who is the actual attending physician or admitting physician. So all of those specific elements that are required, those basic requirements in the conditions of participation, our Notify Worklist will support all of those elements through this secure channel. Next, this is just an example of what a direct secure notification looks like through direct secure messaging. Once again, this is a secure channel. So all of those specific requirements that are outlined within COP, they will have all of those elements within this actual notification. So it will provide the type of care event that is taking place. It is going to provide the sending facility where that care event is taking place. It is also going to share who is that attending physician, the date that event is taking place, the name of the patient, and then it will also expand on the reason for that care event. So what is that care event? Why did that care event take place? So it is going to provide those additional details as well. Next, we have our email notification. This is a non-secure channel. And so when a provider does subscribe to receive notifications through a non-secure email, it is really going to provide just basic information about a care event that has taken place. It is going to notify the provider to log into our Notify Worklist to view additional details regarding that specific care event. So this is not going to provide the minimum elements for COP. We do have different use cases where providers do want to receive just that tap on the shoulder to let them know that a care event has taken place. And this is a non-secure channel, so those PHI elements will not be included in the actual notification that is sent out to providers. It will, however, trigger them to go into the Notify Worklist to view additional details regarding that specific care event. And then lastly, this is just an example of our text message notification. So providers can subscribe to receive notifications through text message. This is a non-secure channel as well. So once again, those elements that are required to meet COP will not be included in the actual message since it is a non-secure channel. It is really going to be just that little alert for a provider to say a care event has taken place for one of your patients. Please log into the Notify portal or your Worklist to view additional details regarding that specific care event. One thing that we did want to mention, which is a very nice service within our event notification tool, is that we do have the ability for providers to have a direct access to our point of care exchange. And so as you remember, initially the point of care exchange we talked about is that single platform that allows providers to go out and actually access patient information for their patients on from any different facilities that those patients may be seeking care out in the community. So it is a single platform where providers can go in and actually view additional information about that care event that's taking place. So not only can the provider receive that notification of that their patient has had a care event, they can actually log in through direct access to the point of care exchange through our Notify portal to link into the point of care exchange and actually get additional details regarding the specifics for that specific event. So if you are interested in understanding what type of services were provided during that specific care event, if that patient has had lab services, what type of information, as far as the admitting provider, what was rendered, what care was rendered, you will actually be able to view that all within the point of care exchange, which is integrated completely within our Notify platform. So to date, we do have several subscribers that are receiving notifications through South Dakota HealthLink. We have sent out over 143,000 notifications to our subscribers. Through that, we have subscribers that have subscribed to receiving death notifications, and we have sent out over 3,500 death notifications. And then as well, we have our subscribers that are also interested in readmission notifications. So are there patients being readmitted to facilities within 30 days? And we have sent out over 4,000 notifications for readmissions to our subscribers as well. So we have a big network of hospitals that are currently connected that are contributing this information. And so as you can see, if it is something that you are interested in, that technical infrastructure is already there in place. And so it would be a very seamless transition for you to actually sign up, enroll, and start sending those notifications out to your providers. We did want to quickly mention just a few other use cases that our event notification service does support. So the first one for primary care providers supporting transitions of care for their patients. This does really align with the new COP. And so if you are a primary care provider that is really looking to support those transitions of care for your patients from those inpatient settings back to your office within that timely manner, certainly our notification service can provide that ability for you to actually engage those patients early on and actually get those patients back into your practice for follow-up care. We also have a number of care management programs that are using event notifications. And what they are using event notifications for is to really support the management for their at-risk patients. So patients that may be at high risk for inpatient admissions, our care managers are actually using Notify and event notifications to help really manage those high-risk patients and try to keep them from going in for inpatient stays and inpatient visits, and really supporting them with more community-based care. We have payers as well that can use event notifications to support with wellness coaching, and once again, for their members to try to avoid members going in for hospital admissions, and really supporting them with referrals to those community-based services. So if you are a payer and you have a wellness program and are interested in learning more about Notify, that is certainly a use case as well that we can support through this service. And then lastly, we did want to mention as well, if you are a hospital that has quality improvement programs in place where you are trying to identify and manage high-risk patients for readmissions, that is also something that our event notification can support by providing you notifications for those high-risk patients that may be at risk for being admitted to those hospitals within a 30-day period or even sooner. So we do have the ability to send those notifications as well. We did want to share with you just a use case that we currently have with one of our Notify subscribers. So managing patient-centered medical homes are responsible for managing patients, and certainly our notification service does support those efforts. And so we do have a PCMH program that is currently using Notify for their medical home patients to support with those care transitions and really get those patients from that inpatient setting back into that ambulatory setting within a timely manner to avoid any inpatient readmissions and for that post-acute care. So we did want to share that with you. We do have several other use cases that are posted on our website. So if that is something that you're interested in looking at, we will provide information in the next slide that provides our website. You could log in, and we have several different use cases currently right now that our Notify application is supporting. So how do you sign up? If you are interested in signing up to use our event notification service to meet COP, all you would need to do is contact us on our website. Let us know that you are interested in signing up to subscribe to event notifications. If you are a current member, you already have your participation agreement in place. We will schedule a meeting with you to go over training for the service, and then we will work and support you with your training for that service as well. So it's a pretty easy process for you to actually start using it. for current members and also for any new members that would be interested in the service. It would really just be contacting us on the website, telling us you're interested in signing up for the service, and then we will have a member of our team reach out to you and schedule next steps for getting you enrolled in the service. All right. We did also want to mention that we do have an upcoming webinar if you are interested in learning more about our products and our interoperability services. We will be doing a product showcase for our point of care exchange. That will be on April 13th. So we are going to do a half-hour webinar that will do a deep dive into the point of care exchange and really provide some additional information on how that service works. So if you are interested in attending that webinar, we did want to mention that. You could register now on our website. And we will have additional webinars that will be also scheduled to actually showcase some of the other products that we talked about as far as the interoperability services that we offer. We would like to thank you for attending this webinar today. We hope that you got additional information on our service. If you are interested in actually signing up, please feel free to sign up and log into our website. And then we will be back in touch with you and talk about next steps for getting you enrolled in event notifications. Once again, thank you for attending this webinar. We hope to see you at future webinars and have a great day.